So I grew up in Auburn, Nebraska, a really small town in southeast corner of Nebraska, about 3,400 people, so literally a one stoplight town. But growing up there, I really saw the value of sports. It was very important to community life. Start reading about sports medicine, different injuries, the way the body works. I found this, I really was fascinated by that. So I think that was kind of the two combined even early in childhood to really steer me towards a career in medicine. And really what I enjoy is having a patient come in with an issue or a question and seeking some guidance, and then ultimately helping them get back to doing what they want to do. That's in sports, that's really the goal. As doctors, we tend to want to interrupt people almost immediately to ask questions. So I think with my patients, I try to make a concerted effort to just listen to what they want to say initially. Once we kind of have an idea of what their goals are and what they want to accomplish, then kind of trying to come up with a personalized plan. So I really try to personalize my treatment, and even thinking outside the box a lot of times. I think in sports medicine we do have to go, there's not a playbook for it a lot of times. If someone's injured in season or in the middle of their training for a marathon and they say, I want to get back at this state, sometimes we have to be a little bit creative in terms of how we do things, and there's not really a recipe for that treatment. So it's really a lot of listening and bouncing ideas back and forth. So I try to be very collaborative with patients as opposed to dictating what I think is best or what the typical recipe for this injury would be. People with orthopedic injuries and specifically sports medicine injuries, it can really impact your life, your everyday life, in terms of if you're living with pain every day or you're just not able to do what you want to do recreationally for your own enjoyment, your mental health. So I think what inspires me to be the best physician that I can be for my patients is really to allow them to return back to an enjoyable life, whatever that looks like for them. Well, we have 3 daughters right now, so they take up a lot of the hobby time, which is great. I love spending time with my family. So we have 3 daughters. Our oldest is 9, our middle is 6, and our youngest is 3. So they're almost exactly 3 years apart. So really a lot of our, my wife and our recreational time is with them. So again, doing some activities with them. They like to do tennis, golf, dance, those kind of things. So we try to spend a lot of family time. Personally, I do some running. I still like to try to keep up with some recreational running, certainly not elite by any means, but a little bit of running, a little bit of golf. But mostly it's family time. And I think just, being here in Sioux Falls, we're really excited about exploring some new adventures, taking advantage of the different kid-friendly opportunities here. So I think that's really a lot of our hobbies.